everyone. I'm Roderick Vicente, caregiver student of St. Augustine School of Nursing. Today, we're going to do inserting of an NG tube. So the first thing we need to do is to gather all of our supplies. So we're going to need some gloves, the NGT tube, a tape, some PH strips, some lubricants, and a to syringe, and then a cup with a straw. Now, we can go wash our hands. The patient and provide a privacy. You need to make sure the bed is at height that's comfortable to your patient. Position your patient in a high Fowler's position. The side of the bed you're on is the nostril you're going to choose. So I'm on this side of the bed. I'm going to use this nostril to put the tube down. Now we need to measure the tubing. So we'll start from the tip of the nose. We'll go to the ear and then we'll go to the fluid process. So this is about how long we're going with our tubing. Some tubing has marks on it like this. So you'll know if it does not have marks on it, then just take a little piece of tape and put it on that place. So you'll know how far it goes. We're going to take our lubricant, dip it on our tubing. Trying to make this comfortable as possible for the patient. Then I'm going to insert it. The tube has its natural curve to it already. If you can see that, use that as an advantage. So go with the curve angle down as if you're trying to get to the opposite ear. I'll insert it just a little bit, ask the patient how he's doing with. Now we're gonna have them help us, so we're gonna give them a cup of water with a straw. While advancing, tell the patient to take a small sip and swallow. And that's going to help to get the tube down because they're going to help swallow the tube. Now we've reached the point that we miss. Next thing we need to do is to check placement. As you're advancing, if you notice they're starting to cough or they're starting to act like they're choking, you are in the wrong spot. Inserting tube, it's also a good idea to hook the patient up to the pulse ox so you can keep an eye on how they're doing. So to check placement, you're going to need the acetoserine. So you'll attach it to the bottom and just pull out a little bit of content. You don't need a ton. I'm going to use the pH strips to put the pH strips should be become acidic. That's how we can know we're in the stomach. A pH of 1 to 4 is indicative of proper placement. A chest X-ray will commonly be ordered to verify placement as well. Now we're ready to tape. I'm going to use a big piece of tape and then cut it down. The middle halfway, then this part's going to go to on the nose, and then this part we're going to wrap around the tubing, and this is going to help it secure in place and does not go anywhere. So now it's in. You you can get a safety pin or you can get another piece of tape and then secure it to the gown.